This fall, as the nation continues to battle the COVID-19 pandemic, Black CEOs and young Black leaders from across the country teamed up for a series of conversations about vaccine hesitancy and misinformation, with a specific focus on questions from young people about the vaccine.
What we do know about vaccines is that they do really two things. Number one, they prevent you from getting really sick and dying, which I think is probably a good thing.
That's Dr. Georges Benjamin, Executive Director of the American Public Health Association, talking with Dejah Headen about the importance of the COVID-19 vaccines, vaccine efficacy, and the importance of wearing masks as students and teachers return to the classroom.
So hi, I'm Dr. Georges Benjamin. I'm the Executive Director at the American Public Health Association. I'm a physician, both an internist and an emergency room doc.
My name is Dejah Headen, and I am a first-year student studying human biology at North Carolina State University. All right. Why should I get the COVID-19 vaccination if vaccinated people are still getting sick and spreading the virus?
You know, that's a great question. And, I've been practicing medicine for a long time. And one of the things I certainly have learned is that no single medication is perfect, and vaccines are no exception. What we do know about vaccines is that they do really two things. Number one, they prevent you from getting really sick and dying, which I think is probably a good thing. And this particular COVID vaccine does that very, very well. The second thing it does is it does dramatically reduce your ability to get infected or to infect other people. And it turns out the COVID vaccine also does that really well, but not as well as it prevents you from getting real sick and dying. So that once you're vaccinated, in a small number of people, you can get infected and you can infect other people. But guess what? You don't stay infected very long. And at least that period of time in which you can infect other people, you can protect yourself by wearing a mask to reduce that risk. You want to ask another question? Be my guest.
I didn't come with any other questions prepared.
Well, you must want to know something.
Well, I've been vaccinated since March, so
Okay.
I've kind of seen how the numbers have been watching the news and watching media and stuff. So I've been watching that very closely because I live with a high risk parent. What are the concerns regarding that? Is it lessened because I'm vaccinated? Should I still be more cautious?
Well, look, that's a really great question. And the short answer to that is that the most important thing that you can do is what first of all, you've already done. You've gotten yourself vaccinated. The second most important thing you can do is make sure that your family member is also vaccinated, unless there's some medical reason why they can't. And by the way, the number of medical reasons why you're not getting vaccinated is very, very small. So most likely they can be. And of course, fully vaccinated. And then just doing the kinds of things you would normally do around the house, washing your hands. If you get ill, if you get sick with any of the symptoms of COVID or they get sick with COVID, then do what you can to kind of self-isolate, protect yourself from each other. And then, of course, get tested to make sure that it's not COVID. And, we're going in cold and flu season. So cold and flu season, we're going to have people with sore throats and symptoms and the sniffles and all the things that go along that, by the way, are also many of the signs and symptoms with COVID. So getting vaccinated and early identification about whether or not it is COVID or not is very important. And by the way, both of you get your flu shot. Dejah, I want to thank you for doing this. This is really, really wonderful to spend your time doing
Absolutely.
this. I thank you.
Anything
very,
I can do much to help get more people vaccinated and help get this pandemic, just get through it.
It's folks like you that are going to help us get through this, and you're an inspiration. I thank you.
Thank you. And thank you for all that you do. And thank you for sharing all this information because it's very necessary that people are getting the right information.